Hello, uh, I am Dr. Iqbal, working as a sonologist for the last 35 years here in Rawalpindi, and I am here today to talk about ultrasound findings of two silent threats to global health, that is hepatitis B and hepatitis C. As you know, hepatitis B and C are viral infections which quietly attack one of our most vital organs, the liver, and causes its silent damage. Over time, this causes persistent inflammation and, if left unchecked, leads to severe life threatening conditions like liver cirrhosis and cancer. The good news is that we have a powerful, non invasive tool to monitor this threat, which is called ultrasound. We use two primary types of ultrasound. One is called grayscale or B mode ultrasound for the study of the structure of the liver, and the other is called color Doppler ultrasound, which is for the function of the liver. And together they give us a complete health report of our liver. If anyone has either virus, a regular ultrasound is the most important checkup because it is safe, quick, and non invasive. Today, I want to explain exactly what we look for during ultrasound scan for a patient suffering with either hepatitis B or hepatitis C. Now, the first the grayscale findings. Reading the scar tissue. The grayscale ultrasound is the black and white picture that tells us about the physical health and structure of the liver. Think of it as mapping the organ for damage, and here we are primarily searching for sign of cirrhosis, that is severe scarring. The findings are: number one is changes in the size of the liver. We often see the size of the right lobe of the liver, which usually getting smaller, that is shrunken, while the left lobe of the liver tries to compensate by getting large in its size. This uneven shrinkage confirms the chronic damage. The finding number two is the surface, which become nodular. In advanced cases, the smooth outer edge of the liver becomes bumpy or wave-like nodular. This is telltale sign of severe established cirrhosis. Finding number three is the texture. A healthy liver looks soft and smooth, whereas when hepatitis virus caused significant internal scarring and stiffness across the liver, then the liver appear with coarse, rough, or lumpy texture. The finding number four, that is the formation of a new lump. The most critical finding, we carefully look for new solid masses, a priority alert for potential hepatocellular carcinoma or liver cancer. Early detection here is the difference between life and death. By studying these physical changes of the liver, one can tell exactly how far the disease has progressed. After grayscale study of the liver, we will go for the color Doppler ultrasound examination, and that is the checking the circulation. The color Doppler ultrasound adds a critical dimension, that is the movement. Color Doppler uses red and blue colors to show the blood flow in and out of the organ, like in the liver. Scarring is like a construction site that jams the flow of blood. Now, here, the first finding is the traffic jam. We examine the main blood vessel, that is the portal vein. If the liver is stiff, blood pressures build up, and that is called blood. This is the portal hypertension. With the help of color Doppler, we see the blood flow getting sluggish, turbulent, or even completely reversed, moving, that means moving backward. Reverse flow is a clear indicator of a severe, potentially dangerous obstruction. Next finding is the like bypass roads. These are the shunts. When the main road is blocked, the body creates small side roads. We look for abnormal collateral vessels or shunts. These bypass routes confirms the pressure is dangerously high. After studying the liver, we can see the other changes in the abdomen, like spleen. The spleen gets enlarged. The blood backup often causes the spleen to become enlarged, called splenomegaly. This is another red flag that the circulation is compromised. The next is the free intraperitoneal fluid, which is called ascites. Due to chronic liver disease, there is increased portal pressure, and that leads to leaking of serous fluid into the peritoneal cavity that is that will be easily seen at hepatorenal pouch as well as in the pelvic region. In conclusion, for everyone who is listening, the ultrasound is the most powerful defense. It gives us a real time report card on liver health, the structure, and the circulation. Please do not wait. If anyone has hepatitis B or C, commit to regular ultrasound surveillance. A good sonologist will help you to catch these findings early, ensuring that timely action saves your life. Thank you for your listening.